This is the Health Matters program produced by the Ministry of Health. I am your host, Alicia Martin. Today we'll be talking about suicide prevention. Joining me in the program is Dr. Mark Constantine, the head of psychological services at the Mental Health Unit. Welcome to the program, Dr. Constantine.
It's a pleasure being here, Ms. Martin.
So we've recently observed World Suicide Day prevention under the theme Changing the Narrative, Starting the Conversation. So today we want to first define what is suicide. I know many persons would have heard of the term before. They would have maybe heard of somebody's experience. But what is suicide? How do we define this?
It's interesting that you're asking me that question because it sounds like a very simple question,
It
right?
does.
What is suicide? And the immediate response that you will get from average people, suicide is when someone takes their own life. But there is one very important word that if you don't use it in that sentence, it really does not define it, and that's the word deliberate. It has to be the deliberate action of someone taking his or her own life, intentional or deliberate.
Definitely. What is the situation here in Guyana for persons who are watching and maybe are wondering how many persons in Guyana would usually do this? We don't want the numbers, but like, what is the situation here?
Well, as you rightfully said, I know not going to divulge into stats or anything like that, but suicide is still there, like in many other societies in the world. But what I can tell you that we have seen a decline, tremendous decline in attempts, both in successful suicide and those who attempt suicide. And this is largely due to the aggressive work that has been carried out by the Ministry of Health and by extension the Mental Health Unit.
Okay, what are some of the misconceptions about suicide that you may frequently encounter?
Um, we got to look at myths and facts about suicide. One of the biggest misconceptions that we have out there from the public when it comes to suicide or persons who attempt or commit suicide successfully is that the person wanted to die, right? And that is, of course, a myth. That's not a fact. Um, Persons who commit suicide basically commit suicide because they wanted to end the pain, they wanted
Mm.
to end the struggle, they wanted a solution to whatever challenge they were dealing with, not necessarily wanting to
To
die,
die.
right? I like to give this example. So a person who is dealing with clinical depression, for instance, and depression we know is one of the main causes for persons who will probably commit suicide or attempt it. It's like a person standing in a tunnel, and when they look left or in front of them, no light at the end of the tunnel. They look behind them, there's no light at the behind them either. And so that's what it is for a person, right? There is no light there. So what we have to do is show them the light.
Definitely. Can you explain some of the common risk factors associated with suicidal thoughts and maybe behaviors?
Well, from a mental health perspective, as I said, things like depression, schizophrenia, persons who struggle with chronic anxiety, and all of these sort of things. But there's a lot of other social factors also. Persons whom are addicted to certain substances. It has been known that a lot of people who commit suicide are persons whom might have been intoxicated at the time when they actually committed the act. So, substance abuse. There's a lot of other social factors, relationship issues, and persons cannot cope with certain factors that it relates to relationships.
Yes.
So those are some of the common things that might be contributing factors, not causes. I want to make that very clear because a lot of times we're very quick to say this was the cause and that was the
Yeah.
cause. Um, and it really was not the cause, what it was the trigger. It was really the trigger. The cause is sometimes a much bigger picture than what we think it actually was. So these are things we've got to always take into consideration.
Indeed. We're living in a modern world where technology will continue to develop. What role does social media play in contributing to maybe suicidal thoughts or maybe alleviating those as well?
Social media has its usefulness, and it also has the side of it that is not so useful and helpful. Influence. social media can be very, very influential when it comes to persons. Here, the fact is this, Miss Martin, social media influences all of us in one way
True.
or the other. And for someone who might be depressed or might be contemplating, ending his or her own life, social media can have a tremendous contribution to that. Listening to persons and listening to stories, right? And persons just follow trends sometimes. And interestingly, there are websites out there sometimes who can tell you some of the easiest way to kill yourself. I know it sounds absurd, but it is there,
Yes.
right? So it does, but then the other side of it is that social media can also be used to spread positive messages, right? Helpful messages for persons that might be struggling with difficulties and challenges in life, and to say, life is still a grand thing. Don't end it, don't waste it. Of course, a person who might have, let's say, clinical chronic depression, sometimes things like that does not resonate with
Mhm.
them, but if you spread positive message, you might be able to help someone before they even reach that stage.
Yes, definitely. I know the mental health unit has been doing a lot of work over the years, and you guys continue to provide the necessary services that persons might need. What services are available for persons who may have suicidal thoughts, who may have mental health issues? What services can they access here?
Therapy and counseling. Anyone, the public out there, anyone from the public out there, you or anyone you know who might be struggling, um, it is just as easy as just picking up the phone and making a call. Call the number 225-0804. You'll get onto the receptionist and say, listen, I would like to make an appointment to see someone, right? Of course, you're not going to have to tell that person what your issues are. Just make the appointment, and when you see the therapist, then you're going to, talk to the therapist about your challenges. And one of the things I would really like the public to know is that here we practice confidentiality.
Which is
Whatever you
very
bring,
important.
critically important, paramount to anything else that we do.
Thank you, Dr. Constantine. We're going to go into a short break and be right back with more on suicide prevention.
It's easy to forget about your mental health. So taking a break and prioritizing your mental well-being is crucial. When you're feeling stressed, anxious, or overwhelmed, yes, take a break or participate in an activity that will calm your mind or release some tension. Meditate, eat right, sleep in, exercise, or do something you enjoy with friends and family. Be bold and talk to someone you trust. With the proper support, you don't have to go through this alone. These activities significantly benefit your mental health and overall well-being and can reduce or prevent stress. Remember, you must prioritize your health and well-being. Caring for our minds is just as important as care for our bodies. Take that break, walk outside, breathe some fresh air, and come back feeling stronger or more refreshed. A message from the Ministry of Health.
The HPV vaccination campaign is back. The Ministry of Health has restarted its HPV vaccination campaign, which targets anyone ages 9 to 45. The HPV vaccine is safe and highly effective in preventing cervical cancer in women, as well as penile and anal, mouth, and throat cancers in men. This vaccine is available free of cost at all health centers across the country. For children to be vaccinated, we will require you, the parents or guardians, to sign a consent form. The vaccination process is quick and easy, so why wait? Visit us and get vaccinated today. Protect today for a healthier tomorrow.
Welcome back to the program. Dr. Constantine, how has the field of suicide prevention evolved over the years? And are there any new trends and techniques when it comes to dealing with patients?
When it comes to the whole term suicide prevention, we have to understand what that entails. And the prevention of suicide comes with awareness,
Yes.
right? We spread a lot of awareness. And, very important for me to say that um, trying to alleviate the scourge of suicide that we have on society is not a one-man show. And we're not going to be successful if we approach it from that angle. It is basically everybody's business, right, to try to prevent suicide. And so, as a result of that, even the Ministry of Health and the Mental Health Unit, we have been partnering with different agencies and NGOs, right, in trying to prevent this problem that we have. And we do so through training sessions, through printing of educational materials, awareness in schools, and at community level, right? The Ministry of Health has partnered, in the mental health unit, we have partnered with NGOs that are doing a lot of work in this area. And we've done so by going into communities across all 10 administrative regions of this country and spread the message of suicide prevention and awareness.
How do persons react to these awareness activities? What is
The-
their response like, especially in the regions?
we have not had a negative response from anywhere. People welcome the message. People welcome whatever material and training and all of that is offered, um, because they see the need for it, and the public knows that it is a problem and that it is everybody's problem. Because a lot of time when you go into the communities, one of the things I do, the first thing I ask, if I have a group of people that I'm training, for instance, the first thing I ask, who has ever known someone who died by suicide? Or if you didn't have someone who died or at least attempted, and
Yeah,
you'll always see hands in the air. So it becomes personal to people. And because of that personal element, people step out and try to put their best foot forward.
indeed. And having everyone involved in prevention is very, very important. On that note, how can family and friends, how can they recognize these warning signs in maybe relatives or somebody that might be close to them and help them get the help that they need?
You know, it's important for me to say this, and I always say this. When it comes to a person who might be contemplating ending his or her own life, there are a lot of times signs. Signs are not across the board, though,
Mhm.
right? To say that this is what it was for this person, it's going to be the same for
Yeah.
everybody else. That's not so. But one very common thing to pay attention to is the person saying they will kill themselves.
Mm.
That is something very often that is taken for granted. No, man, he bluffing. Don't worry with him, man. He always talking it. But that's not something to be taken for granted. If someone is saying that they feel like a burden, they just want to end it all, they just want to die, or they wish they could die, these are signs to pay attention to. And there are a lot of other things, like people giving away their personal possessions, going and visiting family all over the place suddenly and saying goodbye to them. Then there is the isolation aspect where people withdraw from social activities
Yes.
and all of these sort of things. And of course, that also goes with depression. But there's a lot of different factors to pay attention to, right? Increase in substance use and substance abuse and all of these things. So, but as I said, it is for one might not necessarily be the same thing for someone else.
Have you heard? The Ministry of Health has launched its cervical cancer screening voucher program for women aged 21 to 65. Eligible women can pick up their vouchers at any distribution site in their regions. Each voucher, valued at $8,000, can be used at any of the health facilities listed on the back of the voucher. Cervical cancer caused by persistent HPV infection is the second leading cause of cancer-related deaths among women in Guyana. Early screening is crucial to detect and treat precancerous cells. Early detection saves lives. Ladies, don't hesitate to get screened for cervical cancer today. Your health matters. For more information about this program, call 227-4357 or visit the Ministry of Health's Facebook page. The Ministry of Health has launched its eye testing and spectacles program. This initiative caters for anyone under 18 years of age and persons 65 years and older. Persons requiring an eye test can utilize a voucher valued at $2,000 at any of the opticals listed at the back of the voucher. If a patient requires spectacles, he or she can then uplift another voucher valued at $15,000 to cover the cost of the eyewear. Vouchers are available at various hospitals and health centers in your region. To learn more about this program, call 227 4357 or visit the Ministry of Health's Facebook page. Your eye health is important, so why wait? Get your eyes tested today. Your sight, our vision.
What step can communities take to create environments that promote good mental health practices? I know many communities may have recreational groups and spaces where persons can go and relax and so on. So for community leaders, what can they do to make those spaces more friendly and, encourage persons to follow good health practices that will help their minds and so on?
Um, Initiate activities. A lot of times what you will find, I've been around a lot, and you see there are facilities there, but it's very inactive.
Yes.
Create activities, meaningful activities for young people, especially in the community. And let's say it's a community center that has a building, put up positive messages, stick it up all over the place, right? For them to read it. From time to time, invite people. If you don't have them in your community, invite people. If you're a community leader who may have the necessary skill and background to come and talk to these youths, right? Instill good values in them and help them to understand what they can do, to live a life that's going to be healthy and positive and all of that, and remove the judgment and the criticism.
How do you address the stigma against seeking mental health help? I know many persons think that okay, if somebody goes to the health center and say they're suffering with depression or this or that, it might come across a little weird. But how do we deal with this in our society today?
I hope that's something of the past, Miss Martin, after all the work that has been done.
Yes,
But the stigma still exists in some cases. And, how you remove that is through awareness again and education, right? But I think it also has a very personal element to it. Persons must see this as part of their overall health and well
yes,
being, right? And whether it is depression, it's anxiety, it's panic, it's stress, not being able to manage your stress level, and all of these things, there shouldn't be stigma on these things. And these are things that are important to our overall well being. Persons should be able to get help from it without any sort of mockery or judgment, being placed on them. They know the thing about it is that only you know how you're feeling. No one else
definitely.
does not know
And
that.
since personal action must be taken on that note, let's talk about the importance of taking mental health breaks for persons who have jobs that are strenuous, a little tedious here and there, persons in different work environments. How important is this and how necessary it is for them to do this? And what advice do you have to superiors and supervisors with regards?
Well, here, depending on the nature of what services you're offering. But if you have a business, or it's a service where um, your staff in groups maybe can take breaks, or individuals can take short 5-minute breaks, right? If they feel overwhelmed, especially if it's a very stressful environment that they are in, right? It's important to allow that to happen. Of course, it must be monitored because some individuals may very well capitalize on it, and you find them taking more breaks than actually working. And I think that is why maybe some, businesses are hesitant. But it's important finding areas to de-stress, things to just um, empty yourself out back, right? I say to people, you got to find on a day-to-day basis what it is that you can do to help to de-stress from the pressure of work and life and all of it. I mean, driving in traffic today is a big
Yes.
stress by itself, right? Find what works for you to de-stress, whether when you get home it's to look at a movie, or just maybe just sit down and relax and do nothing, play with your pet, get into the garden, water your plants. Different things work for different people. Some people might want to go and hang out a little bit with their friends after a hard year's work, whatever it is. But on a long term, it's important also to take breaks, getaways, get away for the weekend, get away for a week. You don't have to go out the country. Right here, you can go to certain places that's there, and just de-stress.
Definitely. What advice would you give to someone who is caring for a loved one who may have suicidal thoughts? How can that caregiver as well maintain, good mental health and be able to support that person?
Talk to them. Talk to them. I just this morning I was saying it's important to be a listening ear and to be a caring shoulder. I think those are two very important factors. Always be willing to listen and always be a shoulder for someone to lean on, right? Without it becoming a burden to you also, right? But I think a lot of times that's what individuals want. They want somebody who will listen to them. No, they need to know that there's someone there who cares, who cares and who will not judge me and who will not criticize me, right? Um, those are very important factors. Show care and concern and love.
Okay. Can you talk about the importance of follow-up care for anyone who would have attempted suicide before?
But the thing about it is, if someone would have had suicidal ideations, as we would say, and they have been receiving therapy, and let's say after a number of weeks, they would have gotten past that. There is always room for that person if something triggers it again to always call back, right? We may not necessarily be calling everyone, on a one-on-one basis. Hey, how you doing and whatever. But that room is always there for them to call again, right? When the case is brought to a closure, right? Or what as we say, we discharge that patient, right? We also say, listen, if you ever feel the need again, if anything resurfaces, always reach out. Do not hesitate.
Definitely. Before we wrap up today's program, do you have any final words to leave with our listening and viewing audience?
Well, for sure. If you see signs, you know how you feel as an individual. And if you feel a certain way or you see certain signs, right, get help, get professional help. And if professional help is not possible immediately, find someone that you can confide into, someone that you can talk to, someone that you trust, right? Of course, you don't want to go tell your story to everybody out there because, or anybody, because of the stigma again
Yes.
that is out there. But find someone you can talk to, right? And if the needs be for professional help, do not hesitate to call the number 225-0804.
Thank you, Dr. Constantine, and I do encourage you to keep up the good job that you've been doing here at the Mental Health Unit.
Thank you very much, Ms. Martin. You're
This has
welcome.
brought us to the end of Health Matters for today. I'm Alicia Martin saying goodbye for now.